All right, let's get right into it. We're going to do a super high-yield, no-fluff walkthrough of two OSCE stations that can really trip people up, the jaundiced patient and the infectious outbreak. My goal here is to get you ready to absolutely crush it and score maximum points. So picture this. You walk into the station, the clock's ticking, you can feel the pressure. You look at the patient, and their eyes are yellow. Right away, your mind is probably racing through all the possible causes, right? Hepatitis, some kind of obstruction, hemolysis. But hold on. Before you leap to any of those, what is the one single thing you have to do first in your physical exam? Everything, and I mean everything, starts with that physical exam. And more specifically, it starts with you understanding exactly what you're seeing. See, the examiner doesn't just want you to say the patient's eyes are yellow. They want to know that you get why the yellow shows up there before anywhere else. Your approach here has to be systematic. It needs to be second nature. So first up is inspection, and you need to be very deliberate. You're going to say out loud that you are confirming scleral icterus. Why? Because that is the earliest and most specific sign of jaundice. Only after you've nailed that do you move on to things like palpating the liver and taking a history. Now, this is the golden nugget of information that's going to impress your examiner. So why the sclera? Well, the white part of your eye is absolutely packed with a protein called elastin. And it turns out bilirubin, that's the yellow stuff, has this huge chemical attraction to elastin. It's like a magnet. So the sclera just soaks up the bilirubin, turning yellow way before you'd ever see it on the skin. Mentioning this little fact shows you have a real deal understanding, not just some memorized checklist. Okay, so we've got the individual patient down. Now let's switch gears to the outbreak station. This is a totally different ballgame. Examiners are notorious for setting very specific traps here. They want to see if you can think beyond just treating one sick person and start thinking like a public health doctor. And that's the absolute key takeaway. Figuring out the patient has hepatitis A is great, but that's only half the job. The other half, the part that really separates the top candidates, is showing that you have the instinct to protect the entire community. And here is trap number one. They're waiting for you to miss this. The second you've identified an infectious disease, your brain needs to immediately jump to this question. Who else was exposed, and how do I protect them right now? This means you're thinking about things like vaccines or immunoglobulin for anyone who is in close contact. It's an immediate action step. And this is the second huge mistake you can't make. You can't just treat the people who are sick and call it a day. You have a duty to find the source of the outbreak and shut it down. Is it a contaminated food handler at a restaurant? A dirty water well? If you ignore the source, guess what? The outbreak just keeps on going. So, avoiding the traps, that's good, that's passing. But if you want to really stand out, you need to show your thinking on a higher level. And examiners love to poke at this with a big picture question to see how you really think. Just imagine it. The examiner leans forward, looks you right in the eye, and asks you this question. Now, this isn't a trick. It's an open invitation for you to show off that you truly understand public health. So how do you give them the perfect answer? You answer by drawing a really clear contrast. You explain that treating an individual is, by its very nature, reactive. You're helping someone who is already sick. And that's critical for them, of course, but it does absolutely nothing to stop more people from getting sick. Environmental infrastructure, on the other hand, is proactive. When you fix the contaminated water system or improve sanitation, you're protecting everybody, the entire community, even people who haven't been exposed yet. You're cutting the outbreak off at its source. You can even break it down further for them. Environmental control physically stops the virus or bacteria from getting to new hosts. It's the move that actually ends the outbreak. It's the difference between constantly bailing water out of a leaky boat versus just plugging the hole. One solves the problem for good and even prevents future outbreaks from that same source. Whew, okay, that was a lot. So let's boil it all down to the three things you absolutely have to remember. The stuff you can take with you right into that exam room. Number one, you see jaundice, you go straight to the eyes. Your first move is to inspect and confirm scleral icterus. And your reason? The high elastin content of the sclera gives it a special affinity for bilirubin, so it shows up there first. Number two, in that outbreak station, do not fall for the two big traps. Your management plan has to include both post-exposure prophylaxis for the contacts and a plan for finding and dealing with the environmental source. And finally, number three, think bigger. Think infrastructure. When you get that big picture question, you need to articulate clearly that environmental fixes are the best way to stop an outbreak because they are proactive, they protect everyone, and they cut off the problem at its very source. So there you have it. You've got the clinical science, you've got the public health strategy, and you've got the super high yield points locked in. Walk in there knowing your stuff. You are ready for this. You've got it.